Currently, India is negotiating a free trade agreement with the United Kingdom, and also starting negotiations with other countries also with very ambitious timelines. However, there are many concerns that these free trade agreements have for developing countries, including India, especially in the areas of access to medicines that you have rightly pointed out. The UK-India FTA that is being negotiated shares similar concerns, as it could have a drastic impact on drug prices, medicine prices, and it could impact the timely entry of generic medicines in India and in other developing countries. So, civil society globally has been advocating against this and has asked the countries to not negotiate intellectual property chapters, which could be one of the barriers to entry of these medicines.
You heard the voice of Roshan John, intellectual property lawyer, talking to the People's Dispatch about the scope of the UK-India Free Trade Agreement negotiations on medicines. In this episode of Charter4Health, we approach the discussions on free trade agreements, commercialization and privatization of health systems, and the impacts on local economies, healthcare, and access to medicines in developing countries. Welcome to Charter4Health, a PHM podcast series on the right to health. Hear the voices and insights of health rights defenders at the forefront of the struggle for health for all from around the world. I am your host, Miguel Garcia, and this is Charter4Health, a podcast series from PHM Global. Follow and share from wherever you are on iVoox or go to our website, phmovement.org. We are the People's Health Movement. Join us in the struggle for health for all. Our guest today is Abhay Shukla. He's a public health physician based in India, working on public and community health issues. He's a senior consultant and a national co-convener of the People's Health Movement, India. He has co-edited and authored the books Review of Healthcare in India, Health System in India, Crisis and Alternatives, as well as Dissenting Diagnosis, exposing the malpractices in the private medical sector in India. Abhay, welcome to the program. I want to ask your perspective on privatization and commercialization of healthcare and its impact on healthcare access in the Indian context.
So, as you might know, India has a huge private healthcare sector. It is one of the largest private healthcare sectors in the world. And within India, about 70% of healthcare is given by private hospitals and private healthcare providers. And these are very commercialized. And, as I talked recently, India has the third largest number of billionaires in the world after US and China. So, more than, say, UK or France or Germany or Russia or Japan. And these billionaires, where are they making their money from? It's an interesting question. And an analysis according to the Forbes list of billionaires this year, after manufacturing, the second largest number of billionaires in India are from the healthcare industry, which means that huge numbers of billionaires are being created. Their wealth is getting created through pharma and healthcare. And they are earning this money based on what people are paying. So because people have to pay high amounts for healthcare and for medicines, that makes these billionaires. So that's the kind of, high level of commercialization of healthcare that we have in India. And this has very adverse consequences for ordinary people. So every year, about 60 million Indians are pushed below the poverty line because they cannot pay for healthcare expenses. Around 35 million Indians are pushed into poverty because they cannot pay for medicines. They have to take loans or, whatever. So that this is the commercialization of healthcare which is hitting people in India very hard. And that is why as PHM, and especially in the state where I work in, which is Maharashtra, we have devised certain strategies to deal with this.
And this is also giving a huge impact around the globe because India is one of the main producers of medicines and vaccines. So what is the impact that this is bringing to other parts of the world, not just the Indian environment, but how can that bring shockwaves around other places that depend on the medicines and the vaccines that are produced in India?
Yeah, so India is known as the pharmacy of the world, and we are the third largest producer of medicines by volume in the world. It's huge. But as healthcare and also the pharma industry becomes more and more corporatized, the prices of medicines and prices of healthcare services are likely to go up. And although Indian medicines are cheaper than the medicines produced by many of the countries of the north. But still, with growing corporatization, it's likely that the prices may become unaffordable more and more for people around the world. And secondly, this financialization of these enterprises. So when finance capital enters into healthcare, then the entire orientation becomes more and more profit driven, and then takeovers, mergers take place, and because of this, then usually the products become more expensive and less affordable for people.
Let's take a short break. You're listening to Charter for Health, a PHM podcast. Stay with us.
We are the People's
Health Movement.
PHM brings together health rights activists and organizations from around the world.
For over 2 decades, PHM health defenders have been at the forefront of the struggle for health for all.
We maintain an independent voice without fear or favor.
But now we need you to stand with us.
We need your support to continue our critical and independent intervention on all health matters.
To contribute to our cause, go to our website, phmovement.org, and find out how.
Contribute
And say
Proudly
That you support
Health
For all.
health for all.
health for all.
Health for all.
health for all.
Follow the discussions on health issues at the World Health Organization on the WHO Tracker website. Through the WHO Tracker, PHM closely follows the work of the World Health Organization and prepares commentaries on agenda items at the WHO governing body meetings. These include background and critical health perspective analysis with recommendations for policymakers and civil society. Visit the WHO Tracker on the People's Health Movement website at phmovement.org. Join us in the struggle for health for all.
What were your expectations and the lessons learned here at the PHA5 in Mar del Plata in Argentina? How did you find these discussions here?
Well, it was very interesting. It is all the sessions were quite lively and very diverse. And obviously, all of us, I think, learned a lot from the different presentations. What for me were 2 or 3 very interesting, highlights were, first of all, the kind of energy which I saw in Latin America. And, the activists from different Latin American countries, of course, all of us are facing tough situations, including in Argentina. Our governments are not exactly very democratic. But despite that, there's a very strong tradition of social activism and also health activism in Latin America. Like just today, there was the 40th anniversary of Alames, which shows, that social medicine has a very rich tradition. So that energy of health activism from Latin American countries was very inspiring. And the second is that despite the constriction of democracy in so many countries across the world, and not only in the global south, even in the global north, despite that, there are lots of strategies which in different ways people are developing, and there are so many different kinds of, streams, the women's movement, indigenous people, racial minorities, and various other kinds of groups which are really, and also a lot of people from the global north who are fighting in their own somewhat different kinds of situations, like countries like, say, Belgium or even, the United States. So it's inspiring to see and learn about all these struggles.
We are the People's Health Movement, bringing together health rights activists from around the world. Join us in the struggle for health for all. This episode of Charter for Health was produced by Annelyn de Coquelar, Ana Brachar, and David Verstock. Editing by Luisa Fernanda Betela. Technical support by James Von Duren and Edwin Otzin. Special thanks to the People's Dispatch Video Archive and Doctors Without Borders MSF Access Campaign. My name is Miguel Garcia, and this is Charter for Health, a PHM podcast. You can find much more about PHM and its call to action by logging into our website, phmovement.org. This is a People's Health Movement production.
We
Are the
People's
Health
Movement.
PHM brings together health rights activists and organizations from around the world.
For over 2 decades, PHM Health defenders have been at the forefront of the struggle for health for all.
We maintain an independent voice without fear or favor.
But now we need you to stand with us.
We need your support to continue our critical and independent intervention on all health matters.
To contribute to our cause, go to our website phmovement.org and find out how.
Contribute
And say
Proudly,
That you support
Health
For all.
health for all.
health for all.
Health for all.
health for all.
Follow the discussions on health issues at the World Health Organization on the WHO Tracker website. Through the WHO Tracker, PHM closely follows the work of the World Health Organization and prepares commentaries on agenda items at the WHO governing body meetings. These include background and critical health perspective analysis with recommendations for policymakers and civil society. Visit the WHO Tracker on the People's Health Movement website at phmovement.org. Join us in the struggle for health for all.
Hey everyone, I'm Chiara Bodini, co-editor of the Global Health Watch 6, flagship publication of the People's Health Movement. I am also a producer of the GHW podcast. Listen to the first season of our podcast in English, Spanish, French, and Arabic on iVox. You can also go to our website phmovement.org/GHW-podcast.
Today, India provides affordable generic medicines for MSF and millions of people around the world to stay alive and healthy. This is possible because of India's long-standing generic industry, which is a result of its carefully crafted intellectual property laws. However, there is a threat to this pharmacy of the world. India is negotiating several free trade agreements and it could be asked to remove some of its health safeguards. This could impact the generic industry and drive up drug prices. We must stop this. India should continue maintaining its policy and place people over profits. We rely on affordable, quality-assured generic medicines produced in India to treat people in our care, including people living with HIV, tuberculosis, hepatitis C, and other infections which affect the most vulnerable communities in the regions that we work. If India is no longer able to produce generic medicines because of free trade agreements, then the competition that brings down prices will end and people will not have access to affordable medical products that they need. We want India to continue maintaining its pro-public health laws and policies. People should be able to access affordable, quality-assured generic medicines produced in India. Medicine shouldn't be a luxury for anyone, anywhere who needs it.